Your Excellency, Lieutenant General Dr. Sheikh Mohammed bin Abdullah Al Khalifa, Chairman of the Supreme Council of Health, Chairman of the National Taskforce for Combating Coronavirus COVID-19. Colonel Professor Hisham Ali, General Manager for Medical Affairs, Dr. Dalal Al-Hassan, General Manager for Administration Affairs, our honored guests, dear distinguished speakers, colleagues, and students. On behalf of King Hamad University Hospital, I welcome you all to this year's Ethical Symposium. We have been conducting these meetings for the past 8 years, and we appreciate your attendance as it reflects how valuable it is for all of you to take some time and reflect on the ethical dimensions of the topic of this year's symposium. We selected telehealth as it has been a vital tool to communicate with patients, deliver healthcare services, and provide education during the current pandemic. There is a wide spectrum of ethical issues that needs to be discussed in order to ensure that we provide the best care to all our patients and trainees, while adhering to the highest safety standards and the highest ethical standards. We are delighted to have a distinguished group of speakers today, and we wish you all a rich learning experience. We will start with opening remarks from His Excellency Sheikh Mohammed Al Khalifa, and then give you an outline of the day. Once more, welcome to KHUH Virtual Learning Space, and welcome to the symposium.
Dear colleagues, telehealth is an important method of healthcare delivery that Bahrain is moving towards steadily over the past few years. It has become an essential tool of patient care during COVID-19 pandemic. Telemedicine enabled continuity of care for many patients and eased the strain and the parallel damage that the pandemic could have placed on the health of people living in Bahrain. I am pleased to see the resilience of our healthcare institution as they have all demonstrated impressive capability to act under pressure, to be innovative, and to be committed to providing outstanding patient care. Under all circumstances, Bahrain continues its efforts toward digital health care system through the National Electronic Medical Record and National Health Insurance Health System, and we are always committed to universal health coverage in keeping with recommendation from World Health Organization. And we continue our commitment towards the Sustainable Development Goals. I take this opportunity to thank all healthcare workers and administrators who are contributing daily to the care provided to people living in Bahrain. And I thank King Hamad University Hospital for their excellent choice of the topics to be discussed today to highlight ethical concern around telehealth, and I wish you all a very successful symposium. Thank you very much.
Thank you very much, Your Excellency. We appreciate your time and your commitment and your support. Thank you very, very much.
Thank you.
We would like to just let all our attendees know this is the program for today, and you will find in the chat box a link to all the sessions schedule that will pop up soon if it isn't there by now. And I would like to take this opportunity, like the old days when we used to be in live symposiums and sessions, we used to take group photos with our guests and speakers. And we don't want to miss out on that. So that's all. Prof. Corbally, if you don't mind turning on your camera, it's photo time. All right. So Stephanie, you're capturing? that okay, Stephanie? All right, wonderful. Thank you so much. Corona does have a lot of benefits. It's moved us forward with digital education and telehealth and all of that. So, Ms. Luma, I welcome you now to the podium to do the housekeeping remarks. And in the meantime, we will mainly have the speakers for session 1 and the panelists, while the rest can sit back, relax, and wait for their turn. Thank you very much. I'm very personally delighted and honored to have all of you with us today, speakers, guests, Sheikh Mohammed, of course, and all our attendees. So welcome to the session.
Thank you very much, Dr. Dalal. Good morning, everyone. Your Excellency, thank you. It's an honor to have you with us. And thank you to the distinguished guests for being a part of this fantastic panel. Before we begin, I think we should just go through some housekeeping concerns. So if you don't mind, Stephanie, just putting on the screen. All right, so some points to keep in mind. For all attendees, we ask that you sign in with your first and your last name. It's really important as we want to make sure that our attendees are registered and that they get their CME certificates at the end of the conference. Always keep in mind not to sign in with your device names, so just sign in and out, correcting that. In terms of Q&A, we'll have an option for you to enter your questions. So if you notice in your panel at the bottom right of the screen, there's a Q&A button. Just insert your questions and we'll address them at the end of each session. Keep in mind to minimize the chat option unless you really just need technical support, so we can help you there. And in terms of scheduled breaks, there will be some breaks between each session. We'll have 7 minutes, so if you need to grab a coffee or take a break, you'll have that opportunity. And don't forget to wait till the end of the session at session 3, because we'll have a very interesting debate between 2 graduate medical students, and it'll be a very interesting discussion. Last but not least, we'll be sending out a survey to get your feedback on the full spectrum of the symposium. So please keep that in mind before you sign out. One last reminder, the CME certificates will be sent out within 1 week. So be ready to receive it with your email. Thank you again, and we look forward to hearing the discussions.
So we'll hand over now to the chair of session 1, Professor Hisham Ali. You could start by introducing Dr. Jamal Saleh while he shares his PowerPoint.
Thank you, Dr. Dalal. Before starting the session, I would like really to express my sincere thanks and appreciation for His Excellency Lieutenant General Dr. Sheikh Mohammed bin Abdullah Khalifa, the Chairman of the Supreme Council of Health in Bahrain, for promotion of health and for his endless support for KHH and its activities. Since the COVID-19 offense, which has been like for ages so far, the medical professionals has proven themselves to be very resilient, not to the rest of the world, but also to the virus itself, by looking for different tactics and serving their purpose mostly, which is the health provision to our patients. Also, our training department has proven to be very resilient by continuing to set and do the 8th version of the Ethical Symposium, but this time via Zoom. I think it's just the time to zoom at the first session, and we'll be zooming at Dr. Jamal Saleh, a very reputed colleague, orthopedician, and a very brilliant brother. And he'll be enlightening us about the history of telemedicine, and he will explore the historical background of that. But before that, we'll just put some highlights in his very rich CV for those who doesn't know him, which I don't think there is anybody. He is a fellow of the American College of Surgeons, fellow of the Royal College of Surgeons in Ireland as well, chair of the Committee of Investigation of Professional and Ethical Errors of Physicians, president of Bahrain Association of Sport Medicine and Sport Sciences, and also he was politically involved as a member of the Bahrain Parliament. I leave the floor for Dr. Jamal Saleh.
Good morning to you, and thanks for King Hamad University Hospital for organizing this important symposium. My thanks go to Shaikh Mohammed bin Abdullah Al-Khalifa, the chair of the Supreme Council of Health. It's an interesting topic to start with, the history of telemedicine, and one wonders how did it start? So basically, let's start with the first slide. Okay, just a sec. Okay, so when Neil Armstrong set his foot on the moon, he said, it's a one small step for man, yet it's a giant step for mankind. And when you think about it, it's really amazing to know how telemedicine evolved from the old days to what we have at the time being. I could count so many milestones and steps, small steps that man has created over the thousands of years till now, but I could identify for this presentation 10 of the most important ones. Let's start with defining telemedicine. Telemedicine is basically sharing medical data between two or more remote sites. In the old ages, that was achieved using primitive means, but in the modern days, it's used through telecommunication technology. Simply put, we need three elements. We need the capturing the data. We need a means for transmitting and sharing this data. And on the other side, we need someone to receive this data. This is as simple as it is. Now, capture can be audio and can be visual, or audio-visual together. Okay. So where did it start? It started with an Arab physicist, Ibn al-Haytham. Ibn al-Haytham, for many of you who don't know him, who do know him, was called Al-Hazin. And his most famous book, Kitab al-Manadhir, the book of optics, was being taught in all universities around the 1000 or about 1000 years ago. And this is a picture of the translation of that book in the Latin language. And it was basically the way things got started with cameras. So he was the genius of capturing the images, and he put all the elements and the basic information and the basic rules for how light goes through different medias and how we can capture that media. So basically started the idea of the modern camera. So it is called the camera obscura. I remember in the old days myself and with my cousins and brothers, we would go into a dark room and some of us will stand outside the door and there is a little hole in that door and we let the light go through that little hole and we start dancing behind, and that dancing will be translated to the obscura principle, which is an inverted image of a black and white shadows. So Johann Zahn developed that, and he started using it as a way of taking pictures from the outside world, and he used it for the artists to draw their drawings. That was in 1685. Then photography came, and as we know now, you can see on this slide the first picture that can be traced to modern photography. It is by Joseph Niepce. He's a French physicist who took the first photograph, picture of anything, basically. So what we see here is the Legras big state farm, and he took that picture from the window of his house. That was in 1825. So what happened afterwards? Alexander Graham Bell invented the telephones, and that was in 1876. Now we have audio, and with this, people started communicating with the telephones. There's an article in The Lancet dating back to 1879, only 3 years after Bell invented the telephones. And in the Lancet article, they said, we can use this technology to reduce unnecessary office visits of patients. Imagine that. That was 130 years or 150 years ago. Well, this is not a gun. It is the first video camera invented by Etienne Marie in 1882. And it looks like a gun, but it's not a gun. It's basically what we see, that circle is the tape. And amazingly, this is the first video camera on record. What happened next in 1924? This is a visionary picture. It was published in the magazine, a gazette, a magazine called Radio News. They imagined that was in 1924, only a few years before the television was invented. And in that you can see on the left side a patient being examined by a doctor, and the doctor, you can see the doctor on the little screen inside, when there was no TV, and they thought that maybe one day, maybe there's something called the radio doctor, and the radio doctor is going to diagnose patients' diseases through a media. Isn't that amazing? And you can see that on the right side, the Radio News in 1924. This guy transformed the world. He's Philo Farnsworth. Farnsworth invented the TV on a commercial basis in 1927, and all he could broadcast and transmit was just a single black line from one place to the other for a couple of years. And then people came to him and they said, can you transmit something else other than this one black line? So he decided to do different shapes, and he transmitted them through the TV. So the TV was in 1927. So now we have the telephones and we have the TVs, but the first real use of images in the medical discipline was in 1948, after the Second World War. And it was a transmission of X-rays, radiographic images by telephones only. And that was done in America between the Westchester and the Philadelphia, Pennsylvania. And the distance between the two sites was about 26 miles, 40K. When did we see the first real telemedicine? Well, that was a joint effort between NASA and Nebraska. So the clinicians at the University of Nebraska used a two-way interactive television to transmit neurological examinations and other information across the campus to the medical students. That was a joint venture, as we said, between the Nebraska Psychology Institute and NASA, and then developed to the Nebraska Psychiatric Hospital and other hospitals in the area. So in 1964, the telemedicine link was established between Norfolk State Hospitals and Nebraska University. That was in 1959, the year I was born. Imagine that, what happened over the last 60 years? What stopped all this technology that has evolved all this time, the very fast acceleration of technology to almost, we wouldn't say seized, but to be like a turtle over the last 60 years. Well, it is down to the development of the personal computers, and came back in 1971, followed by the internet in 1983, and then the World Web, which is accredited to the picture that you see, Tim Berners. Now, through these three inventions, technology could speed the transfer of images and audio from one place to the other. So basically, we are bound by the broadband speed. And this is what happened. Over the past 40 years, there was a development of the speed of transmitting all this technology across the world. Not only two sides, but multiple sides. What we are witnessing here, Your Excellency, ladies and gentlemen, my colleagues, is a brief of the history of telemedicine, where data is shared either by two doctors, two health professionals, or a patient and his doctor. Thank you very much for giving me the time to give you this brief. And I hope that we continue to see more topics related to telemedicine over the next couple of hours. Thank you very much.
Dr. Jamal, thank you very much for your very nice presentation. As I always say, history is the roots for everything, but we need also ethics to control it, which will be tackling as we go. Next, of course, we'll keep the discussion at the end of the panel. So for now, our next speaker will be Dr. Leena Alqasem. Just brief highlights for CV. She's a graduate of the Royal College of Surgeons in Ireland. She acquired her Master's of Science specialization in bioethics from McGill University. Then she obtained her professional doctorate in medical ethics from Keele University in the UK. Currently, she is the Chief of Health Professional Regulation Department at NEHRA since the year 2012 till today. As we all know, social media has added killers to our lives, a taste on what we do. However, it's double-edged. It has good, the bad, and the good. Dr. Leena Alqasem will be enlightening us about the ethical implications of utilization of social media and the domain of telehealth. Dr. Leena, the floor is yours.
Thank you, Dr. Hisham.
We will be sharing the slides shortly.
Okay. Thank you, Dr. Hisham. Thank you all for having me. It's an honor to be among the speakers today. I'll talk to you today about ethical matters in using social media in providing telemedicine. Next slide, please. I'll talk about, briefly introduce what telemedicine is, what social media is, and what are the ethical issues involved in each of them. Can we go to the next slide, please? Yeah, and next. So telemedicine is defined by the WHO as, again, next slide, please. It's defined as providing care or healing from a distance. So it is normally, or was previously used in settings where it was not physically feasible for the healthcare provider and the patient to be physically present at the same time or in the same place. So that's why we were using distant healing. Next slide, please. It has, of course, many advantages. Some of them is to provide clinical support. When it's not feasible for patients to come and see you, it's better to communicate with them in some form or way, rather than having long periods of discommunication with the healthcare provider. Of course, it overcomes geographical barriers. If you're not in the same country or you cannot travel, you can still have access to the healthcare provider that, or your doctor or anyone else. It uses actually, of course, telecommunication devices or information technology devices. So it can be audio consultations or video and audio consultations. It can also be used by healthcare providers to share information among them. So you can share ECGs, you can share ultrasound, you can share vital signs. There are several devices now that can transmit live information from patients to healthcare providers, and we can use them to diagnose or treat our patients. We can use the video consultations more than audio to reach remote diagnoses. And the overall goal is to improve healthcare outcomes for our patients. As I said, instead of having long periods of not communicating with them, we can reach out to them at intervals and see how they are doing. Next slide, please. What do you need for telemedicine? It depends whether you're using audio or video, but now most of the communications are with video. They are better than just audio communications. You need encrypted systems, you need firewalls, you need to keep the firewalls updated so there is no hacking or whatever. Healthcare facilities need to record or keep securely the audio and video sessions between the healthcare providers and the patients, and I'll come back to this at a later stage. Why do we need to record that and hold them securely? Next slide, please. So the benefits of telemedicine in general is that you have increased access by patients to the healthcare provider. It improves patient outcomes and it reduces cost. You do not need huge buildings, waiting areas, more staff to take care of the patients. It can actually reduce cost of healthcare services. Next slide, please. There are, of course, direct benefits to the healthcare providers. You can provide healthcare more efficiently. You can follow up your patients regularly. You can follow up with your patients, not necessarily restricted by time. You can talk to them or visit them at any specific time. Instead of having to be in a clinic between 9 and 12 or whatever time, you can be flexible in your time and view your patients at your own leisure. You know, as I said, you don't need to expand on space because, you know, the number of patients are getting bigger. So we do not need to expand on space or hire more staff to cover the larger number of patients that we have. You can adjust medications of the patients. You can make sure that your patients are adhering to the treatment plans. You can give them further instructions or advice over the telecommunication that you have with them. And as I said before, you can share information with other healthcare providers. So if you need a consultation with a cardiologist or a GI or whatever, you can consult with them through telemedicine as well. So it's with patients and with other healthcare providers as well. The benefits to patients, next slide please, is that it's basically more convenient for patients to have telecommunication with their healthcare provider. Why? Because they don't need to leave home. They can see and get medical advice from their healthcare provider while they are at home. People who have young children or are caring for elderly patients, they do not need to arrange for care at home to go and see their doctor for themselves. So they can do both tasks at the same time. Patients do not need to miss on work hours. Now, I don't know if employees will see this as an advantage, but it is an advantage. So they do not need to go out of the office to see their doctor. They can see their doctor right where they are working and get the medical advice that they need. And of course, who would not mind skipping on travel time with the congestion and the traffic? You know, you can see your doctor while you're at home and do not need to drive your car down to the hospital and find a parking, etc., etc. And perhaps the most advantageous use of telemedicine, especially nowadays, is that it will decrease the spread of infectious diseases. Now, with the pandemic that we have, the use of telemedicine has proven its effectiveness more than ever, perhaps, because we don't want patients to be exposed to infectious diseases. We don't want them to come to the hospital to see their doctors. Access to rural residents, perhaps we don't have this in Bahrain, but in other bigger countries, they do have a problem of travel between areas. They have long distances to travel to see their doctors. So we don't have this in Bahrain, but it is an issue that is considered in other countries. And overall, there is a better outcome for the patients with the continuous communication with their doctors. Next slide, please. So what do we use telemedicine for? As I said, you can have second opinions with your other colleagues, more specialized doctors. You can manage their medication of the patients. You can manage chronic illnesses for patients. You can share medical information. Some also believe that telemedicine can be used in disaster relief. So if you have a highly specialized doctor who is located in one area and you have a disaster, you want to consult them on something, you can use telemedicine instead of having them travel to your hospital and provide the care that is needed. Next slide, please. The disadvantages of telemedicine. There are several arguments regarding the disadvantages of telemedicine. The first one is that it depersonalizes our relationship with the patients. We're not seeing them face to face. There is no real interaction. So, we're not really dealing with our patients properly. However, I think with the use of video consultations nowadays, you are actually visualizing your patients. And so this is not a true claim. We can have personal relationships over the video conferences or telemedicine that we use. Of course, there are limitations to what we can do over telemedicine. For example, you cannot discuss end-of-life issues when you're having a telemedicine consultation with your patient. You cannot break bad news, perhaps, over the phone with your patient. You need to have this on a face-to-face basis, but there are other wide spectrums of use that we can utilize telemedicine for. Some also argue that with the absence of body language, that we are missing a lot of the non-verbal cues that we can pick up when we are seeing our patients. Again, I think this can be a good claim if you are using only audio consultations, but with video consultations, you can pick up a lot of the non-verbal cues from the patient's body language. Next slide, please. Now, the other side of the story is the social media. Social media was never intended to be used for professional or medical purposes. There are, yes, a lot of beneficial uses of social media. You can use it to build your social or professional network. You can keep updated with the latest updates in your profession. You can communicate with other colleagues in your same specialty. You can campaign about certain issues that you feel are important, whether it's on a personal level or on a professional level. And you can have access, or you can share information and idea, but not for medical purposes. Next slide, please. Now, the concerns with social media. Why do we always say do not use social media for providing healthcare services for your patients? There is a limited security with social media. No matter how high your privacy settings are or how high your security levels are, these medias are not totally secure. And so when you put something out about a patient, you are breaching their confidentiality. How do you ensure the security of this information? Something else is that once you put something on the internet, if you decide to remove it at a later stage, you can never really remove it completely from the internet. So it's always there. So we need to be careful about this. Because of the limited amount of information that we can share through social media, the statements that we put can be interpreted differently by different people. So we're not getting, it's not personal care that we're providing. We can use it to educate the public, but not for direct patient care, because you need detailed information and communication with the patients to be able to do that. And social media simply does not provide you with this sort of scope that we need to provide telemedicine. Next slide, please. So what are the ethical issues? The biggest concern with using social media for providing healthcare services is the security of social media. We simply cannot ensure security. We cannot maintain the confidentiality of the patients. It cannot be done. Next, please. The other issue is, and perhaps this is next to the security or directly related to security, is ensuring confidentiality. We, by law, by code of professional conduct, are required to maintain the confidentiality of our patients. If we disclose information on social media about patients, how are we ensuring their confidentiality? Even if you depersonalize the information that you publicize on social media, publishing pictures or surgical procedures, they can actually be linked to patients. If someone really wanted to, they can link it to date, they can link it to time, to surgical procedure performed, location. So all of these factors can actually lead to breaching patient confidentiality. So it is extremely encouraged, and it is forbidden, actually. I'll have to say it as forbidden. And if you go back to the professional conduct issued by NHRA for Bahrain, you're not allowed to share patient photos, surgical procedures, or radiological images of patients to publicize on your personal accounts in social media. You simply cannot do that. Next, please. Privacy, again, how do you ensure privacy of patients? How do you know that you're communicating with the patients in the first place? If you cannot ensure confidentiality, security, how are you ensuring the privacy of the patient? How are you going to discuss patient cases and ensure privacy? Just think about it when you're using social media. Next, please. Harming patients. Now, with the use of telemedicine, and especially at this stage with the coronavirus pandemic, some positives have come out and some negatives have come out. The negatives are that a lot of people have converted to social media to provide healthcare services. Now, you can actually harm your patients because you do not have access to the full information that you need using social media to provide a diagnosis and a treatment for the patient. So it can lead to misdiagnosis, which can lead to harm to the patients and ultimately medical litigations. So at all costs, we should avoid using social media to provide direct healthcare to patients. Next, please. Interactions with minors through social medias. You know that anyone can generate an account in social media, even minors. They can just forge or change their date of birth and they can have an account. So how do you ensure that the person you are dealing with on social media is in fact an adult and not a minor, and you're providing medical information or instructions to a minor patient, which you should not do legally without the presence of a guardian or a parent. So again, an issue to consider. Next, please. Whether you're directly interacting with patients or using telemedicine or social media, you should always maintain the highest level of professional conduct that is expected from you as a healthcare provider. You should never provide misleading or false information. You have to be honest. You have to use secure systems with encryptions. Maybe that's not a physician's job. It's the IT department or the facilities job to do that. But you know, you have to maintain the highest level of professional conduct when dealing with social media and telemedicine at the same time. Next, please. Licensing. Of course, I have to talk about licensing. I cannot go and talk about ethical issues without mentioning licensing. So anyone who provides telemedicine in the Kingdom of Bahrain has to have a license to practice in the kingdom. And your instructions or your medical care provided or management of patients must be restricted to your specialty or your area of specialization. You cannot give consultations on everything in medicine. You're restricted to your own specialty. That's obvious, not always, unfortunately. Next, please. Liability, you have to keep in your mind that you may be still liable for medical lawsuits or complaints or whatever. So that's why I need to emphasize that healthcare facilities have a huge responsibility to keep records of audio or video consultations with patients for future references. So if a patient claims that I was not given this, or I was not told about this, you have a backup to go back to. If that's not an option, you have to document clearly what happened in the medical record of the patient. So having telecommunications does not mean you do not document in the medical record. Believe me, it will protect you more than it will protect the patient. So you need to document. And next, please. So the use of social media, we need to be really, really aware about the limitations of security of the social medias. We need to keep our privacy settings at a very high level and regularly check them. We should never use social media to discuss individual patients. You can use it to educate the public or communicate with your peers or your colleagues. Do not venture, of course, into specializations other than your own, and do not misrepresent yourself on social media. Thank you so much. I hope you found this beneficial. Thank you very much.
Leena, very interesting. Thank you very much. Just a small announcement regarding the Q&As. Kindly restrict it to questions for now, and don't send your name except if stated otherwise, like you requested to do that, because we need to have it free for questions. As I said, questions will be addressed at the end of the panel. You can send your questions for all the three speakers, and then we'll deal with it as we go. Our next speaker will be Dr. Vishnu Renjith. And as you know all, that the nursing is the backbone for the current medicine and has been always so. And if I say otherwise, I'll be criticized badly, surely. Now, Dr. Vishnu Renjith, just small touches on his CV. He's a lecturer at the School of Nursing and Midwifery, Royal College of Surgeons in Ireland, Bahrain. He holds a master in medical surgical nursing and also a PhD in nursing from Manipal University. He is a fellow of Royal Society of Public Health, UK. He has published not less than 30 manuscripts and delivered talks at national and international conferences. I welcome him in his lecture that he'll be highlighting about the role of nursing in telemedicine. The floor is yours, Dr. Renjith.
Thank you, Dr. Hisham. Welcome all you to the 8th Ethical Symposium on Telehealth. The particular session, we will discuss about the role of nursing care in telehealth. As we all know that nurses have been a critical link in healthcare between the patient and the physician, and they actually act as independent practitioners or independent providers of care. From the traditional way of nursing to the expanding telehealth model, the nurses are broadening their practice through technology-based healthcare delivery. That's what the definition of telenursing or telemedicine, telehealth nursing says. So telenursing, or sometimes called as telehealth nursing, is the use of telemedicine technology to deliver nursing care and to conduct the nursing practice. It is not an independent specialty, but it is always a component of the telemedicine system. When we see the trajectory of nursing practice in telemedicine, we have evolved from the phase of face-to-face nursing care to the mHealth model, which is widely used now. Whereas in telemedicine model or the telenursing, we use telephones, internet, telemedicine units, and the mHealth. And the mHealth being the latest one, which uses mobile technology, mobile apps to provide care for the patients. So why telenursing is really important in this particular era? As we know that we are in a situation where there is high cost associated with healthcare. We have an increase in old age population. As per the World Population Report, During 2019, almost 9% of our population were on an age group from 65 or more. There is a high burden of non-communicable diseases and chronic illnesses in the community, which again necessitates the need for chronic care, and the hospitals are being reserved for people who need acute care. To achieve the sustainable development goals and the universal health coverage, we need to broaden our coverage of healthcare. World across, we face a critical shortage of nurses and as well as physicians. And we need to save resources in terms of man, material, money, and as well as time. So telenursing would be a proper model which could alleviate or which could achieve these aims. The interactions in telenursing, it is not always between the nurse and the patient. The nurse could contact any health professional, which would be a radiologist or an emergency care physician, and can provide the telenursing. The nurses could interact to another nurse who is in a rural healthcare center and then discuss about the care planning and the care needed for the patient. Or else it could be in situation where the nurse will interact directly with the patient and then solve the issues of the patient. But whatever the interaction it is, it's all focused towards the care of the patient and mediated by devices that overcome the barriers of distance and time. There has been lots of discussion regarding how real is telenursing, because some people will say that it is not a real nursing because there is no direct contact between the nurse and the patient. However, the concept or the philosophy of telenursing is a little broader, where we try to combine the clinical expertise and knowledge of the nurse with the cognitive abilities, the nurse's expertise to critically think, analyze, and interpret the clinical scenarios, along with the communication skills to provide evidence-based care to the individuals. So it is more than just a direct even though there is no face-to-face interactions, the concept of telenursing is much broader. As the previous speaker has told, there are benefits to the both of telenursing, both to the health system as well as to the patients. It could be considered as a very cost-effective method. We can cater to a larger population. It definitely alleviates the daily patient burden on the physicians, whereas in a telenursing model, if they can see that how many of you need to come to the hospital, do you need to go to a primary care center, or you need to go to a secondary care center, all the patients need to come to an emergency or to a tertiary care center. A telenursing model could help to triage these patients, and we can tell them to go to the best services they can avail. Whereas for the patients, it can improve and enhance the quality of care. We could satisfy a very variety of patient needs, from health education to counseling sessions to medication management and so on. So it could satisfy a variety of patient requirements. Telenursing is a very good model for patient education, and we could manage the follow-ups and referral services through the telenursing model. I'll give you some examples on how these things were achieved using the telenursing. This is an example as COVID-19 has emerged. A hospital in US has decided how they can use a telenursing model to educate post-stroke, educate the people who had family members of people who had stroke. Using a telenursing model, the stroke nurses provided education to the family members because there was issues of social distancing. They couldn't call the family member to the hospital and give the education. So using a telenursing model, they have given the education to the patients. Australia and New Zealand has got a very good telenursing model where they triage patients using this telenursing. All the individuals in the primary healthcare center have access to telephone advice and symptom 24 hours, and they could contact the telenursing center and they will tell you where you have to go, how emergent is the situation, and so forth. This is another one where, with as we know that patient with schizophrenia, there is medication adherence is a very difficult thing to achieve. So this was a study where they did, nurse conducted weekly telephonic interviews with patients with schizophrenia, and they could find that this kind of a model could voluntarily increase continuation of medicine as well as the medication adherence scores with patients with schizophrenia. The last one is again the application of telenursing in rural practice. Here the interaction was between the nursing and the nurses from the rural sector to the nurses from the hospital, that is Children's Hospital at Westmead, Australia, whether the clinical consultancy provided clinical consultancy services were provided on nursing and interdisciplinary issues of the rural healthcare center, and the consultation was provided by the main hospital, and they set up an interactive website and a video conferencing session to discuss the patient care issues. So which is a good application of telenursing or telemedicine in rural practice. As nurses, we might encounter with patients prior to a formal formal telemedicine session, so we could educate the patients for telemedicine visits. I think this is a very good role nurses can play. We can have a prefix session where we can tell the patient to download the electronic app or software for the visit. Tell them to make a list of questions they want to ask to the clinician so that it could save a lot of time. Tell them to have the medication and investigations ready with them. If they have the access to a blood pressure machine or a blood sugar monitoring, tell them to have the recent values with them. And it will be always better if they can have a family member alongside them to take the notes or listen to the instructions of the physician or the nurse who is conducting the telemedicine visit. Tell them to make sure that the device, their microphone and camera are working, and use a quiet, well-lit room. So these are some of the points we can educate the patients. And when we see the future of telenursing, it seems to be really promising, because the trend has been started from, the wider trend has been started from 2000, and from 2010, you can see the past decade where there are lots of studies, there are lots of interest in the telemedicine or the telenursing sector, and it still continues to increase. I would like to conclude my talk by saying that we need actually a paradigm shift in our clinical practice, where we invest a lot more resources in a traditional hospital-based care, whereas the population we can cater is very less in number. Whereas in case of telemedicine or a telenursing sector, however, even though we need initial resources, but it will be much lesser when you compare with a traditional hospital-based model. And this telenursing and telemedicine could be considered as cost-effective care with wider coverage and better access. And as the aim of this talk is this COVID-19 pandemic could really act as a catalyst for this paradigm shift in clinical practice, whereby which we could achieve the universal health coverage for all. So that's all about my talk. These are some of my references for you. Thank you once again.
Thank you, Dr. Renjith. I think it's time to conclude our session by addressing the Q&As. First of all, there was a very nice suggestion by Dr. Maha regarding if we can upload all the lectures in our website. And I would add to that, if feasible as well, to have it CME accredited. So we'll work on that, inshallah. I can promise you that. Some of the questions that have reached me so far here. First of all, a question from Ms. Ima Janahi saying, if this telemedicine approach would eliminate the conduction of comprehensive assessment, and if it does so, then how to overcome it? Maybe I can address this question to Dr. Jamal Saleh, who's an orthopedician, so maybe he can answer this. Is it feasible to use telemedicine when it comes to orthopedic patients, for example? And if so, then what are the limitations? How to identify whom to be seen by this modality?
Yes, thank you.
Thank you
very much, Dr. Hisham, and thanks for the question. Can we use telemedicine to establish a very clear diagnosis? The answer, straight answer, is no, especially in orthopedics, because you need not only to listen to the history can be very clearly sought and taken from the patient. Maybe visual examination can also be elicited, but to feel, to touch, to move, limited. That's why maybe in some conditions we can establish a probable diagnosis. But when it comes to being accurate and decisive about the diagnosis and the advice, we go back to the limitations that Dr. Leena has shown us in her lecture. There are limitations to the physical exam. We can have a look at an X-ray and we can diagnose a fracture. Yes. We cannot thoroughly examine the patient when it comes to that. We can stipulate that maybe there is some weakness here or sensory loss there. You can never be sure. So the answer is, again, yes and no. And that's the limitation that we have with the telemedicine. But I'm sure at some point in the future, this will be solved through improving the examination technologies, that can at least let us establish the diagnosis, the examination through feel and move when it comes to examinations.
Dr. Jamal, very true, you said, and the same thing applies to ENT at a great deal of times. Like you've got somebody with otology and you don't know what's the etiology behind it without examining. Maybe it stands more applicable when it comes to follow-up cases rather than freshly presenting cases. Anybody would like to add on this question before proceeding to another one? Okay, now one more question. I think that goes to Dr. Leena. The question from Dr. Khadija Ali. We cannot put a patient radiological or surgical procedure in our personal account, as does mentioned earlier. Can we do that if we didn't mention patient's name, or if we take permission from the patient, him or herself?
Okay, let me ask the doctor, what's the purpose of putting patients' surgical procedures on your social media? Why? You want to get fame? Well, what's the purpose? We either use images, surgical procedures, radiological images for teaching or for publications. For publications, you have proper journals, you can write it up, publish it, and you'll get full credit for it. But putting it on your social media, forgive me, I'm old-fashioned. Why do we do that? Wallah, you see a lot of doctors putting bariatric surgeries, putting radiological images. I did this fracture, it's complicated. What's the purpose? Social media is used for educating the public, not advancing your own followers or increasing them. That's not the purpose. You are a doctor, you have a code of ethics to stick to. So instead of asking me, should we or are we allowed? No, you're not allowed. It's on the professional conduct published by NHRA. What's the purpose? Okay, ask yourself.
Dr. Leena, somebody might put the argument forward and say, well, just to show our patients in Bahrain that, for example, this modality of procedure or management is available. I'll just put an example here. Somebody like very, very unique procedure, not being done except like in certain specific centers. So people might travel abroad to do that instead of being available in Bahrain. I'm just putting an argument. I'm not, so just let us see how does it go when, like from your side.
Yeah, okay, fine. You want to publicize that we have this technology or this procedure in Bahrain, that's completely fine. But then I think that's the role of the healthcare facility. They will publicize in the newspapers or whatever. There are proper procedures for this. And we've seen this a lot. King Hamad announces that this sort of procedure has been done. BDF has done this, Ministry of Health has done that. And there's completely nothing wrong with that, to publicize the kind of services that we have in the kingdom, but not your own private social account. You have limited access anyway. The population you want to get the message across to will be much, much bigger through the proper channels.
Totally agree with you, Dr. Leena. I couldn't agree more, because it has got to be streamlined. Whenever I go on Instagram, I see all sorts of X-rays and procedures, and as to somebody showing his muscles, which I really hate. Another question for you, I think they like you. It says, if the patient is in another country and he's being consulted via telemedicine, so which regulations shall we follow here? Do we have regulations for that?
I'll talk about Bahrain. I don't know about other countries. So for centers that we do, NHRA actually regulates telemedicine. We have regulations for that. And the centers that provide telemedicine, anyone, even the doctors who are outside Bahrain who provide telemedicine through the centers that are licensed in Bahrain, must be registered with NHRA. Not licensed, but at least they are registered. So if there is a case of malpractice or medical liability, you can trace them and you can have someone who is liable. But to, again, each country will have its own regulations. So I cannot speak for countries other than Bahrain.
One more question, actually. I think it's for you as well, but it can be put for everybody. It says by Dr. Wa'il Al-Ani, telemedicine is crossing the borders. Patient can reach healthcare providers outside Bahrain. How this is going to affect healthcare sector in Bahrain? Are there any proposals to protect private healthcare sector in Bahrain?
To answer this or address one facet of this question, and Dr. Leena and others can contribute also. I think my main concern here, Dr. Hisham and the audience, is the privacy of the patient. We need to protect the privacy of the patient. It's not accepted at all to display an X-ray with the patient's details on it, name, CPR. It's not acceptable to show a patient's face or a body on the video screen. So I think this is an important aspect that we have to be careful of. We can share medical knowledge if we aim to spread awareness, either to the public or to discuss certain cases. For example, we have a group of orthopedic doctors and we discuss cases, but we never show the name on the X-ray that we share. We try to protect the patient's privacy at all times. We don't give any details unless it's completely obscured. So I think we need to be vigilant of that. I don't know, maybe Dr. Leena wants to add something else to that as well.
Yeah, regarding the question, I mean, sure, it is the patient's right to seek advice or an opinion from anyone they wish, even outside Bahrain. I would strongly advise patients to ensure that the doctors they are approaching, first of all, are doctors and they are qualified in the area that they are claiming to be specialized in. I don't know if you've heard, recently there was a case in Saudi Arabia of a well-renowned surgeon who was revoked because he was doing surgeries outside the scope of his practice or his specialization. So I think he was revoked. So it will be difficult for patients to see, you know, the license of the doctor. Are they really licensed or not? Are they really specialized in this area or not? It's up to them. They can seek advice from anywhere. It's a global thing. You cannot stop patients.
I agree with you, Dr. Leena. I think it's very important for the patients to ensure that they are dealing with legitimate doctors. And I don't know how they can do that, but I think they have to be very careful seeking an advice from an anonymous or maybe someone who claims to be an expert in this field or that field. It's a very risky area. And unfortunately, it's up to the patient himself, the citizens themselves, to exert the care when they put their personal data and private information to people that they don't know of. And maybe in Bahrain, it's a small country. We know all the practitioners in Bahrain. But as Dr. Awal, if they are going to cross the borders and communicate with people, assuming doctors outside Bahrain, that you don't know them, you have to take it in your hands to make sure that those people are legitimate.
Dr. Hisham, if you may allow me, we are at 10:02.
Sure.
Can keep discussing this, but there are lots of questions in the Q&A. And what I will suggest we do is email them to our speakers. I know there are at least 3 or 4 questions to Dr. Vishnu that we didn't get to yet. So we will email you these so we can get the answers forwarded to the attendees. I am delighted to have a wonderful, rich discussion. And we will move to a tiny break, 2 minutes, and then while we enter the panelists for the next session. Thank you so much, Dr. Leena, Dr. Jamal, and Dr. Vishnu. Thank you, Dr. Hisham.
Thank you very much. Thank you.
Okay, I'll share a quick video where we have the use of technology as our CEO was checking on our trainees who are abroad. Let's do the next one. Is there sound?
السلام عليكم، بارك عليكم الشهر. الحمد لله. بس اوكي الحمد لله يعني. انتم تمثلون مستشفى الملك حماد الجامعي في خارج مملكة البحرين. استقر الأوضاع يعني الحمد لله. Everything is stable. Stay safe and well at this challenging time. I know that you're all representing Bahrain very well.